Thank you all for joining us today. My name is Laura Kuchaita. I'm the Chief of Staff for Michigan State University Office of Health Sciences. At this time, I'd like to take a moment to introduce Dr. Norm Beauchamp. Dr. Norm Beauchamp has been recognized for his excellence in education, leadership, and healthcare. He is currently the Executive Vice President for Health Sciences at Michigan State University. This consists of the College of Human Medicine, the College of Osteopathic Medicine, the College of Nursing, and MSU Healthcare. Norm previously held the role of the Dean of the College of Human Medicine and the Associate Provost for Health Affairs. He is also serving as the chair of the board for the newly established Henry Ford Health System, Michigan State University Health Sciences Center. Dr. Beauchamp is a two-time Spartan, both undergrad and medical school. He completed his residency and 2 fellowships at Johns Hopkins and obtained a master's degree from the Johns Hopkins School of Public Health. Prior to returning to MSU, his roles included the department chair at Johns Hopkins and the University of Washington, president of the Clinical Practice Plan and the Faculty Senate at the University of Washington, and the medical director of the Seattle King County Free Clinic. Dr. Beauchamp has also served as a professor of radiology, neurosurgery, and industrial and systems engineering. His scholarship has been focused on improving healthcare, and with a particular emphasis on stroke diagnosis and treatment. So without further ado, I give you Dr. Norm Beauchamp.
Yeah, hi, everybody. And Laura, thank you so much. You know, I appreciate the introduction because I am just so proud to be able to serve in the role of chair of the board. And one of the things that was hopefully conveyed is just a commitment to health, hope, and healing. And really, that's why we exist. And what brings me so much joy about what's happened with Henry Ford Health System and Michigan State is that we are 2 organizations with such a long history and a commitment to bringing health, hope, and healing. And to be successful, it is the bringing together of our skills and strengths that's the opportunity. And what's been really foundational in this effort is that this isn't about one group taking dominance over the other, but really coming together. And so in the structure, it's why we have the chair of the board from Michigan State and the president from Henry Ford. And it's in connecting that ultimately we become a stronger one. And so I'm really proud to introduce the president of this effort, Dr. Steve Kalkanis. And I'd like to just show a slide that demonstrates, you know, his preparation for the role today. And so it again is my privilege to introduce Dr. Steve Kelkin. Steve serves as president of the newly established Henry Ford Health System, Michigan State University Health Sciences Center. He's the CEO of Henry Ford's Medical Group. He is the chief academic officer. He is Henry Ford II chair and senior vice president of the Henry Ford Medical Group. And he is a professor, and we're super excited about this, at MSU, serving in the College of Human Medicine. Dr. Kelkin has previously served as the medical director of Henry Ford's Cancer Institute and department chair of neurosurgery, Henry Ford Health System. Steve joined Henry Ford in 2004 after completing his neurosurgical training at Mass General Hospital. He graduated with highest honors from Harvard University, and he was awarded the John Harvard Scholarship. And then Harvard Medical School, where he served as class marshal and received the Linnaeus Prize for highest academic achievement. Clearly a very dedicated scholar. His academic effort, his scholarly focus has been on translational research, investigating the molecular genetic differences between short and long-term glioma survivors. And a big part of our work in this collaboration will be cancer. He specialized in brain tumor surgery, he's been involved in numerous clinical trials for brain tumors, and has authored over 150 peer-reviewed publications. Dr. Kalkanis was chosen to receive one of the profession's highest honors in being named a director of the American Board of Neurological Surgery, which is the accrediting and credentialing body for all of neurosurgeons in the United States. And I think what Steve is emblematic of is someone who has committed their life journey, right, to improving the life of others and understanding the strength that all parts of the academic mission, clinical excellence, teaching, and research play. So we couldn't have a better individual to be the president of our newly established organization. And Steve is going to lead our town hall discussion. Steve, super proud to be your partner.
Thank you so much. Thank you so much, Norm. And good afternoon, everybody. This is an incredibly exciting day for all of us. For me in particular, I want to thank MSU President Stanley and Henry Ford CEO Wright Lassiter, Dr. Adnan Munkara, who's the Henry Ford Chief Clinical Officer, and of course, Dr. Beauchamp and one of my many partners in crime, Norm Hubbard, who together, all of us over this last year and a half have helped make a dream come true. And today, I really view as almost an inflection point in the history, the long arc and storied tradition of both of our legendary institutions. And you'll come to know me, I hope, as a worthy ambassador of this new combined entity of both Michigan State and Henry Ford. But from the Henry Ford side, I just wanted to share with all of you joining from Michigan State that the excitement is palpable, the enthusiasm is over the top, that finally, after a century, we have a world-class university academic partner on a pathway to cancer designation, to a medical school campus, to really changing the face of healthcare. And there's nothing that has buoyed us and gotten us through what is arguably the most difficult year in healthcare in our lifetimes. To have this light at the end of the tunnel has been an amazing journey, and it's something that I think all of us are rightly proud of. You know, the Secret Service code name for this enterprise in the early days was Project 96, because you know, the road that connects Lansing and Detroit. But then COVID hit and everything went virtual, and we couldn't travel to see each other in person. But what we quickly learned, one of the many silver linings of this incredible year, is that we were able to make profound connections virtually and in real time. And the distance goes away. And it's not just about Detroit and Lansing, it's about Grand Rapids and Jackson and Wyandotte and West Bloomfield and Macomb and all the points in between, the communities in which we serve, and really to be a beacon nationally and internationally for how we can truly change healthcare. So I hope that all of you can share our excitement and to be serving together as ambassadors for this new enterprise. And our goal over the next few minutes is just to give a very brief overview of, you know, what is the partnership? What are we talking about here? What can we expect? And what is the framework that we've put together? And then really, I think the true value from my perspective is going to be in the question and answer format of really getting to the heart of some of your questions. And so to that end, I've prepared a few slides, and I will share them now, and hopefully they're coming up on your screen, and we'll go into slide mode here. So we don't want to make an incremental difference. We don't want to just view this as another collaboration or a merger. We want to change the world. We want to change the future of health. We want, when the story is fully written years from now, for people to look back and say, you know, when two important and critical institutions with complementary but unique skill sets and opportunities come together, that the exponential progress that can be made is realized. And so when you think about the opportunities in research and in education and in the delivery of healthcare, this is a massive opportunity that I think everyone will take notice. This is one of my favorite early slides that we've used in many of our board presentations. I call it the 2 + 2 = 10 slides, because when you look at what each institution brings to the table, and you consider that when you put them together, it's not that it's incrementally more, it's that suddenly you're the top in the state or one of the top 10 or 20 in the country, and then people take notice, and then we can move the needle, and then we can be that beacon where people want to come, and we can more easily recruit and retain the best possible talent, where everyone's going to really take notice and say, what's Henry Ford and Michigan State up to? Well, what are they doing? And so when you think about the nearly $1 billion in research funding between these two organizations, when you think about the thousands of medical students and residents and nurses who have to come through our enterprise to go out and start their careers, we will be the leading enterprise for the entire state and region for healthcare, period. When you think about our clinical enterprise and the opportunities where we have allopathic and osteopathic physicians coming together to provide services, not only in Detroit and not only in Lansing, but in everywhere in between and beyond, you know, a multi-billion-dollar enterprise. This has power in today's day and age when we're talking about new discoveries, but also when we're talking about impacting and enhancing the lives of the communities in which we serve. So here's the opportunity. And one particular statistic is very telling, and that is that currently, Michigan State, if you look at some of the national rankings for research, ranks in the 50s range in the country, Henry Ford somewhere in the 70s. If you put the two together, we're suddenly a top 20 institution. That's the power of what we can do together and everything that means and that brings. And so our vision when we started this enterprise was to really combine our two families. And we wanted to commit to aligning efforts where it made sense, looking at departments, programs, research enterprises to achieve critical healthcare and educational goals. We want to address social issues also that impact health outcomes for our patients in the state and beyond. And it's not a zero-sum game. I say that importantly because I want to address upfront any concerns that people might have. Well, you know, what about other relationships that Michigan State might have or that Henry Ford might have? We view all of those as only being enhanced because of our two institutions coming together with a halo effect that will really spill over into all of our other relationships, which can be maintained. But this is something that I think will really help us define and realize our goals. So to that end, we've really focused on 5 major pillars, and you'll hear this messaged in many different ways. And I'll show a slide in a moment that talks about the organizational structure. But for us, this relationship is all about research, cancer, education, the healthcare clinical enterprise, and then DEI. And I'll just take a moment to quickly summarize what our goals are. So for research, we will have a machine that takes into account basic science research, translational research, animal studies, clinical research, population health science to fuel innovation and discovery. We have an academically and clinically integrated network of scientists and of academicians, of healthcare practitioners. And at the same time, we've also committed to building a physical edifice, a brand new research tower that will really serve as a physical manifestation of everything that we're trying to do. And it's also about getting the synergies of our groups together where, you know, in the example of precision medicine and the molecular genetic analysis that we do at Henry Ford and all of the things that precision health stands for at Michigan State with Anna Moore and her team, that combination is intoxicating when you think about what it might accomplish. And then you add in AI and machine learning that up to this point has really been focused a lot on engineering in the auto industry, but now with the new healthcare lens, there's so many opportunities that we can realize. For cancer, both of our institutions have invested heavily in cancer. At Henry Ford, this was our very first service line. Just a couple months ago, we proudly opened our new cancer pavilion, the Brigadier Harris Cancer Pavilion on our campus. At Michigan State, the commitment to cancer has been profound, both in the research and in the clinical side. We thought this was deserving of a special call out because I think together we have the ability to fast track cancer research, screening for our populations, the development of new cures, the enhancement of clinical trials, and to truly be a national destination for all aspects of cancer. And so to that end, rather than each individual institution taking a decade and tons of resources to get that coveted NCI cancer designation status, we feel that by combining forces, we can do that in half the time and with really focusing on the synergies and overlaps between what we're offering. Education. Well, we have one of the world's most impressive healthcare educational institutions now in Michigan State, partnering with Henry Ford, which to now has served as a beacon for medical students from multiple universities and medical schools, but also we actually train a third of the physicians in the state of Michigan. So when you put all of these things together, my goodness, what we could offer to the world. And we are committed to a multidisciplinary interprofessional model. So the College of Osteopathic Medicine, the College of Human Medicine, the College of Nursing, these three beacons of educational prowess, we now want to have a marquee showing and a home at Henry Ford Hospital, at Henry Ford West Bloomfield Hospital, at Henry Ford Macomb, at Henry Ford Wyandotte, at Henry Ford Allegiance in Jackson, and everywhere we can find an opportunity to increase our instructional model, the rigor of the teaching experience, and the diversity of educational experiences and the patients that we serve. So I think that, our commitment, first of all, with our osteopathic colleagues, it's been an amazing journey because we already have a wonderful commitment with our COM students currently, even before this partnership. Now that's all enhanced even more. And all three, COM, CHM, and CON will have increased complements of students rotating through all of our campuses. And we're so excited about what that might mean for the future. Taking healthcare as a clinical enterprise, we have, hundreds of physicians in the Michigan State model. We have 2,000 physicians in Henry Ford Medical Group. We have, another cohort of wonderful physicians in Jackson with the Henry Ford Allegiance Group. It's incredible to think of the possibilities of figuring out where there are gaps in care and how together we can fill those gaps. And so one day we may be talking about sort of a collaboration amongst all these medical groups, but in the meantime, there are opportunities in economies of scale with laboratory services, pharmacy services, radiology coverage, but also supply chain and all of the things that come with running a group practice, in addition to making sure that we have cardiology care, pediatrics, and so forth in the areas where we need it the most. And at the same time, we're also exploring ways to take our best people, the leaders of our teams, and where it makes sense, giving them dual roles so that there can be a line of sight both into the Henry Ford and Michigan State worlds. And that brings us to DEI. Diversity, equity, and inclusion is a critical differentiator for why these institutions came together in the first place. And we need to promote principles of diversity, equity, and inclusion across the entire platform. And some people have asked, well, why is its own pillar? Shouldn't it be just part of everything we do? And the answer is both and yes, and absolutely. We felt it was important to call out so that on slides like this, the world would know that the foundational elements of this partnership are represented with a value-driven system that encompasses DEI. But when you think about what DEI means and how we're going to measure success, in research, when you think about health disparities work, in cancer, when you think about screening our underserved populations, in education, with getting students, even from the high school level, interested in medicine in a diverse way to reflect the communities that we serve. These are ways that we really hope that DEI will serve as a further differentiator for everything that we hope to accomplish. Well, how are we going to put all this together? Here is the very general organizational rubric of how this new partnership is going to work. And at the core is something called a Health Sciences Center. This is the organizational model that will unify all of these efforts for cancer, research, education, the clinical committee, the diversity, equity, and inclusion, but also administration and finance. It's a construct where we can amalgamate and collaborate and have that serve as a legal entity so that we can power forward all of these goals. Now, there's a steering committee, and the steering committee is made up of our senior leaders, President Stanley, Wright Lassiter, Drs. Beauchamp and Munkara, as well as board members from each of our respective institutions, Rima Vassar from Michigan State and David Breen from Henry Ford. The Health Sciences Center, however, has a working board. This is an operational board that will rotate, as Dr. Beauchamp mentioned, its chair. So currently Dr. Beauchamp is the chair. I have the honor of serving as president of this new entity, and it's, again, the honor of a lifetime. And this board is really responsible for making sure that everything is on time and on target, and making sure that we can clear hurdles from all of you so that everyone has the resources they need to succeed. And you know, I'm really thrilled to announce that there have been some reciprocal invitations to further connect our institutions. So for instance, Dr. Beauchamp is now the newest trustee of our Henry Ford Hospital Board of Directors. Dean Aaron Souza is on the Henry Ford System Academic Council. Tony Avellino, who's a friend, and no, this is not a neurosurgical conspiracy, but one of my many partners in crime at Michigan State, serves on our Henry Ford Medical Group Board of Governors. In addition, our education committee is populated by the three amazing deans at Michigan State, starting with Dean Amalfitano and Dean Sousa and Dean Rash. These are now household names at Henry Ford, and we hope to really have that reciprocal relationship moving forward. I have the honor not only serving as Health Sciences Center president, but an associate dean of the College of Human Medicine, and really focused on helping to develop this branch campus in Detroit, as well as an AVP of the Health Sciences Enterprise at Michigan State. So that is how we are structured. One question that always comes up, and I hope to just you know, acknowledge it directly, and that is to say, well, this HSC, does this mean that resources are being moved, or that research is being moved out of Michigan State? You know, will it negatively impact my department funding pools? What about rankings? And then from the Henry Ford side, you know, I get asked, well, if we're attributing everything to this Health Science Center, you know, will we lose our identity? You know, what happens to the grants that I apply for, and so on and so forth. And the best way I can sum it up is that for a year and a half, the best minds that we could think of, we brought them together to basically have our cake and eat it too. We wanted the best of both worlds. We wanted to be able to have a unified construct where everything could be easily counted and attributed. So from the outside world, the NIH on down, they could look at this combined entity and see that 2 + 2 is now equaling 10, as I mentioned earlier, but at the same time, allow each institution to maintain its autonomy and control and, you know, intellectual property and really ownership of their entity. And so the best way I can explain it is that no research funding, for instance, is being moved out of MSU or out of anywhere. Rather, you know, Henry Ford is attributing its research dollars to this Health Sciences Center that is really the core of the Henry Ford MSU relationship. In return, Henry Ford is getting its name and as part of its identity alongside, right next to the Michigan State name, so that both institutions can see themselves on any, you know, accrediting acknowledgement that comes from this work. And at the same time, Michigan State now has a vehicle for joint program development, for added core resources, potentially for joint investment, and also shared governance and oversight. So we really wanted to anticipate any potential concerns, but create something that would be a unifying force. And so to that end, we have some strategic goals for each of our committees. For research in particular, it starts with establishing this research committee that will help us with recruiting and retention. We want to look at all existing and future federally sponsored clinical trials and grants to make sure that the world knows that everything should be counted together so that we rise in the rankings and that we are a national force to be reckoned with. I'm so thrilled to say that 112 current Henry Ford PhD research faculty are being presented shortly for the professorial track appointments at the appropriate MSU colleges within this calendar year. This is a big deal because it allows our researchers to feel as if they're part of the family. It allows Michigan State to have a line of sight into the work that's being done here and to open our cores and resources and intellect, I think, together so that we can really operate on a different plane. And I think that that's happening in real time through the strict regulatory processes that already exist within Michigan State. So the process isn't changing, but the portals of entry are being reimagined to allow this partnership to occur. We are developing jointly branded research programs. And you see some of them listed here, but it's by no means a comprehensive list. Again, cancer we'll talk about separately, but neuroscience, precision health, population and public health, primary care, women's health, but also imaging, radiology, immunology. These are things that really come to the fore when you think about, everything that we have in our wheelhouse and how we can present it to the world. In addition to all of this, this research team is also charged with designing and building and really securing the pathway to a 200,000 square foot research building within the next 5 years. And this is something that all of us are excited about, not only because space is at a premium, because again, it will be that physical manifestation of all of the ways that we are collaborating to try and recruit and train premier academic faculty, premier clinicians, premier researchers to really define what are these frontiers that as a society and in medicine we need to tackle, over the next decade, over the next 30 years. And I want these practice-changing contributions. We want these research innovations to come from this new joint entity that we have birthed together. And I think that we are so poised to be able to do that. So when you think about timelines, this year is about getting our house in order and making sure that our teams are aligned and everyone is on board with the same goals, and to dispel any rumors and concerns and to course correct where we need to so that we can have a platform on which to grow. And then starting next year, we're going to begin the recruitment process of various PIs and scientists to round out all of these commitments, to make sure that our attribution processes work and that we have the best possible foot forward in our rankings and so forth. And then from there, really growing our core labs and our resource infrastructure, which of course, all of you know, is critical to this success. And the funding of this and the flywheel effect is going to be so important in making sure that these investments move forward. Well, let's move to cancer. Cancer is such a huge pillar of what we're trying to achieve. We are jointly designing, as we speak, a job description for what the next cancer center director would look like over this combined entity. And the goal is to really jumpstart our journey to get NCI cancer designation with a P30 grant within the next 5 years. And we understand that this not only has clear benchmarks related to how many patients are on clinical trials, but this proverbial goal of $10 million a year in NCI funding. But even within that, having multiple research cancer foci that are in turn each funded with multiple R01 grants. We know what it takes. We know the recruitment and retention focus and challenge and opportunity, and we are off to the races. We are committed to telling the world that this new entity of many things stands for a cure for cancer. It stands for that institution where you want to go, where you want to drive past everywhere you can think of, where you don't feel like you need to get on a flight for that third and fourth opinion, because right here in Michigan, we are working to reduce the cancer burden. We are addressing cancer disparities in our population, which is so critical. We are engaging our patient population, but we're also using all of the modern day tools that we have to make a difference. So we are part of the NIH All of Us study that is really one of only 7 sites in the country sequencing the molecular diagnostic analyses for 1 million patients. That is a huge treasure trove in which to power our cancer journey so that every patient can get a precision, totally targeted treatment from a molecular level. We can deal with the social disparities, we can deal with screening, and we can look at populations to predict who is at risk, where we can intervene sooner, and where we can move the needle on cancer. And all of this, I believe, is achievable, but it takes everybody working together for this goal. And so, to that end, we have key aspects of each of our programs. And we talked about research, we talked about cancer. When you think about education, this is a major opportunity. And I'm so grateful to Deans Avellino and Sousa and Rash and Dr. Eric Shear and so many others on the Henry Ford side to making this work. We are committed to increasing the incremental student training slots and clinical placements across every single one of our Henry Ford Health System facilities, starting very, very soon. In fact, we are in the process right now of analyzing our current commitment to Wayne State that we've had for almost a century. We will retain our commitment to that institution and to the city of Detroit, but at the same time, we're making room for our new primary partner, which is, of course, Michigan State. At the same time, we know MSU has commitments with other institutions as well. That's all great. It's part of the fabric of this new union that we're trying to build. But I think together, understanding that we will be the premier educational site. And this includes our osteopathic colleagues, it includes our MD colleagues, and it includes our nursing colleagues, because we want everybody to view the experience with the Henry Ford clinical engine as something that is a sought after training site, no matter where you are, no matter where you come from. And we want to be able to offer that. So we are actively working to start that process so that in the summer of 2022, we can flip the switch and begin welcoming these students here. And then every year beyond that to incrementally increase the students that will be coming through. And so there's so many nuances to this, including hoping that within 4 to 5 years, we can have the framework built and set to really start a new regional campus in Detroit that would include obviously the 3 colleges that you see here, but also thinking broadly about public health and about pharmacy and about APPs and everything that goes into training the healthcare workforce of tomorrow. We think that we can do this, and so much more to come on that. When you think about the clinical integration focus, I'll take a moment here to really say that we have to pace this because there's so much excitement. People have asked, well, are we going to become one big medical group? And, what about, Henry Ford doctors who might, have relationships with children's hospitals here and there? Or what about Michigan State physicians who are at McLaren or Spectrum and so forth? We recognize and welcome and celebrate all of these relationships, and we don't want to upend or disrupt anything that is working. We simply want to say that here's an opportunity where the economies of scale suggest that when you come together, we really can find gaps that we can fill both in clinical delivery and in clinical service optimization. And so what we're starting with under number 1 here on the left is really some early wins, thinking about quality management tools and metrics that we can employ across our enterprise, utilizing what it means to be a clinically integrated network and sharing some learnings. What about radiology coverage, laboratory services, pathology services, and what about supply chain? Already, just in one series of meetings, we saved $1.5 million between both of our institutions from combining a pharmacy platform that was actually just a welcome surprise. And the great news is that every dollar that we save and optimize can be reinvested into all of these aspirational goals that you're seeing on all of these other slides. So I really think that that's just the tip of the iceberg in terms of the benefits that will accrue once we come together. And then when we have those early wins in place, we're looking at specialists and co-management of specific services across the state where it makes sense and where we can jointly grow opportunities. And there's such a huge opportunity when you think about the Henry Ford presence in Jackson and the proximity to Lansing, but also when you think about, our Henry Ford West Bloomfield and Macomb hospitals looking northward in the Detroit metropolitan area and what this could mean for individual practices and also educational and research opportunities at the same time. I will tell you that one of the major highlights and manifestations of thinking about combining some aspects of our clinical enterprise really has been manifested by Dr. Rick Leach, who is just an amazing world-class, obviously the Michigan State Chair of Women's Health, who now officially is going to be the first combined chair of both Michigan State and Henry Ford Women's Health and OBGYN. We're so thrilled that, in our midst, when we have these national leaders, we don't need to look any further than our own family, as it were, to really make the decisions that make sense. And I will say that it's not a one size fits all. It's not going to be that every department has one chair and one combined chairs. We're looking at many different models. We may leave things exactly as they are, and that might make most sense. We may have an academic facing chair and a clinical facing chair where that makes sense. Or in certain situations, as was upon us with Dr. Leach, if it makes sense to have one sort of overall chair, then we have the ability to do that as well. And so knowing that already we're seeing these opportunities work in our favor is something that has really given us a lot of enthusiasm as we move forward. And finally, certainly last but not least, is our diversity, equity, and inclusion goal. And I can't underscore enough how important it is to not only see this as its own pillar, but to see it as almost a longitudinal, a horizontal glue, a connectivity that informs every single one of these other enterprises. And so again, as you see here in research, with using DEI goals and metrics to make sure that we do the appropriate investigations in underrepresented communities in clinical research for clinical trial participation with health disparities and interventions in the public health and population health sphere. And my goodness, there's no better time to be doing this than right now during this era that we're living in, when we're seeing, for instance, vaccine hesitancy in our African-American population and in other areas where we really feel we can make a difference by having the right voices in the right seats at the right time. And this is our time. I also say that is true for education, when we have to increase the pipeline of students who are even interested in medicine and who think that a career in healthcare is relevant for them in our K through 12 schools. But certainly by the time someone is in college and they're thinking about medicine, they should be top. Henry Ford, Michigan State should be top of mind as an example of, wow, they're doing something different there, and that's where I want to be. And so we were thinking about innovative ways for curriculum development, and again, giving that platform for COM, CHM, CON opportunities to grow. And then of course, on the clinical side, we all know about the health equity and disparities that we face as a society, certainly here in Michigan, and in particular in the Detroit area. We know what the opportunities and we know what the challenges are, but I think having this partnership be the beacon for a solution to that, not just talking about it, not just having it be a popular slide where we include the letters DEI and think that we're doing something, but to actually intervene and make a difference and to power it for success. That's what we're all about. And so I'm just, I hope you can sense a little bit of our energy and our enthusiasm here, because this is real. In my career here at Henry Ford, and I've had the pleasure of being here for 16 years, I don't remember a time when there was this much energy and excitement, resource allocation, and all oars moving in the same direction to jump into something that feels so right. And it also feels like this is our moment to truly make a difference. And so to that end, we have many partners and leaders across both of our systems trying to figure out how to share this enthusiasm with the world. And so there will be a branding effort and communications effort that encompasses everything from, media, press conferences and additional town halls to what we put on our white coats and logos and everything that comes with it when it makes sense. But obviously, all of you will be key stakeholders, and the teams are working through their due diligence process right now to figure out what will make the most difference. But I do want to just acknowledge that this work is happening, and we hope certainly by the end of this year, beginning of next year, that we will have a face of this relationship that will be immediately identifiable and that the world can sort of see and experience some of the excitement that hopefully all of us will have lived by then. And at the same time, we know that as with all good things, especially in healthcare, philanthropy and getting our communities behind us really can make all the difference. In my experience, over the last 5 years at Henry Ford, the cultivation of grateful patients, of patients who have felt part of our journey, led to one of the largest gifts ever in the country for precision medicine, a $30 million gift from one of our families, the Mort Harris family gift of $20 million on addition to a previous $20 million for our cancer program, and then an anonymous gift of now $36 million for our pancreatic cancer initiative. That's almost $100 million, where the power of telling your story and of engaging with those who are among us in our communities who at the darkest moment of their lives look to us for hope, and we help them find a solution, even when the outcome wasn't great, to feel like there was an opportunity where with a little bit of investment or a lot of investment, as the case may be, we now have the pieces of the puzzle to be that solution. So I thank all of our marketing and communications and philanthropy partners. I thank our legal teams, our HR teams, our administration and finance teams who are just working tirelessly to take two storied institutions, each with multiple decades and centuries of just the way it was always done type of obstacles that we have, and to say, you know what, we're forming something new and we're really onto something. And so I am so excited about the future. I look forward to maybe stopping here and leaving at least 15 to 20 minutes for any questions that anyone might have. And I want to thank all of you, all 600 and some of you for tuning in. And I know many others are going to be listening to it in a recorded form as well. So let me stop there, and I'll turn it over back to the team, and we can hopefully field some questions.
So thank you so much, Dr. Kalkanis, for that wonderful presentation. And we've gotten a lot of questions. We got some questions submitted beforehand, and then there's also been questions that have been asked during your talk. So my name is Jennifer Gibson Levy. I am the VP of Education for Henry Ford Health System, but I also serve with Dr. Kalkanis in the HSC as his Chief of Staff. So I'm just going to kind of amalgamate some of the questions that we received beforehand, and then Laura Kajida will be asking you the questions that have been asked by the participants of this webinar. So the first question that we got was really specifically for research. So there were some questions about, how will this make the research process and administration easier? How are we going to treat the IRB? And then when is the building going to be started to be built?
Well, there's a lot to unpack there. I wish I could tell you that the building was going to be starting tomorrow, because that's the level of what we need. But obviously, we need to do some due diligence. I think that we're exploring, public-private partnerships and investments and ways to get some innovative funding. But and I'm seeing some of the questions coming through here, and I'll answer it in a different order. The research relationships are going to be critical. The IRBs need to be retained in each of the various institutions, but there's nothing like sharing best practices to get us to, a better outcome. And so I think that these committees that are being formed aren't meant to take over or usurp existing practices. They're meant to serve as sort of an engine and a clearinghouse to figure out, hey, Michigan State does this really well. Henry Ford, what are you thinking? We should learn from them, and vice versa. And so, there are questions here about, well, you have this education committee, but we already have curriculum committees and COM and CHM. Exactly. The education committee is really meant to be that vehicle and voice where the existing structures can be put on the table to say, well, this is working really well. What can we learn from it? And by the way, if we're adding 1,000 more students, or if we're adding 100 more researchers, or if we're adding $100 more million in NIH funding, do the current structures make sense, or can we do it in a better way? And so the question about IRBs sort of falls into that realm. And so, and I welcome anyone else, on our team who's on this call to jump in as well.
Great. One other question that came in was how can we explore opportunities outside of health sciences? And there was also a question sort of similar to that in the chat around for non-clinical, non-MD, PhD researchers and members of our communities.
Yeah, I love that question, because it just speaks to the aspirational breadth and depth of what we're trying to do. Every time we have one of our newly formed board meetings, I like to start it with what we're calling a collaboration story, which are examples of unexpected happenings that are occurring outside of what we plan for. So we plan very specifically for health sciences and for research and for cancer and for education. But what about, and this is just, off the top of my head, just hot off the press examples, but, the business school at Michigan State partnering with the Physician Leadership Institute at Henry Ford and, developing new pathways through the business world. That is, an amazing opportunity that just came through. We have, similar opportunities when you think about, and I mentioned this briefly, but, Michigan State's prowess in machine learning and artificial intelligence, when you think about the ability to apply that to the clinical world in healthcare, when, I can take a brain tumor out in the operating room and within minutes have those cells dissociated into a patient-derived xenograft, and our team can develop an avatar in an animal model. But now with the power of Michigan State's analytics platform, within moments do a readout to figure out, what is the prognostic value of what we're learning here that makes a difference in real time for patients. I mean, these are space age things that would have been really thought of as science fiction, even a couple of years ago that are now at our fingertips. So there's so many ways we can expand. I think that, our teams are thrilled by the excitement, but yet we also know that we have to, we have to get our foundations in place so that we can soar even higher.
And then the last one, one of our favorites, how much does this cost and how was it funded?
Well, that's why I asked our philanthropy leaders to be on this call. I have, I tease them to say that, we have multiple $100 million gift opportunities for a research building, a medical school, so on and so forth. I think that, first of all, very seriously, both institutions have put up millions and millions of dollars, in all seriousness, to make this work. We realize this doesn't happen in a vacuum. You can't just be a well-wisher and say, oh, let's do this on fumes. Henry Ford Health System already had an investment into its academic portfolio, and we essentially tripled that and said that over the next several years, we're going to be investing tens of millions of dollars to make this successful. And on a Michigan State side, that is also the case. And so we're also looking at ways to take funding that's coming in and use it in a way to power these activities. So there is a robust financial plan that will be shared with anyone who's interested, and it will become publicly available as we launch this new Health Science Center, so that everybody understands where these dollars are coming from and where they're going. But truly, this is new money that's being invested by both institutions. It's not being taken or quote unquote borrowed or siphoned from existing pools. It really is something that is part of the strategic initiatives of both institutions.
Thank you, Jenny. Steve, I'm going to ask you a couple of questions that came in through the Q&A. The first one, it seems like there might be
Laura, can I just ask you to speak a little bit louder, because I'm having a little trouble hearing you.
Sure, I'm sorry.
There we
The
go.
question came in the Q&A, and I think that I'd like you to expand a little bit more on the distinction between our Cancer Committee and our Research Committee.
I see that, and I was going to preempt it, and I'm so glad you raised it, because a couple things. Even though we have individual committees, and again, we separated cancer out from any of the other areas of focus because of both institutions' investment and the prioritization of cancer. It needed to be its own entity because of our goal to have NCI cancer designation, but it's inextricably linked with research, with education, and with our clinical committee, and with our DEI committee, for all the reasons that we've talked about. So yes, they are separate committees, but each of these foundational pillars interact with the other. It would be pointless to have all of these constructs operating in a vacuum. We want a lot of cross-pollination and collaboration. So to that end, Michigan State, leads 3 of these committees. Henry Ford leads 3 of these committees, and then the vice chairs are from the vice versa, institution. They will rotate over time, but each of these committees is populated with about 7 to 10 people. That is an even mix between Henry Ford and Michigan State. And the specific assignments of many of these committee members are to sit on related committees and to be able to form those bridges. So I can tell you that in research and in cancer, there is an amazing degree of crosstalk when you think about precision medicine and precision health and imaging and molecular genetics and diagnostics and all of those things that go into it. They are definitely in lockstep, but research encompasses more than cancer, and it's focused also on the building. Cancer is focused on the NCI designation pathway, just for clarity's sake.
Thank you. And can you talk a little bit about the relationship between the Education Committee and the curriculum committees in the medical colleges at MSU?
Right, and so I tried to touch on that a little bit earlier when I was trying to emphasize that these new committees are not meant to replace or usurp or redesign or fix something that's not broken. And the whole point is that the Education Committee will be that clearinghouse, that platform where the existing curriculum committees that are already working well and have these storied histories in COM and CHM and CON can come and be shared, essentially, so that Henry Ford can learn from them and vice versa. And it's a place where, if there are obstacles, if there are resources needed, that these curriculum committees that already exist can go to this education group to say, we think we've done a pretty good job, but for this incoming class, here are the things that we're worried about, or to attract the best and the brightest, here's potentially a gap in what we're able to offer. What can we do about that? These are the types of conversations that, that we hope to foster. And, as we talk about building university-wide connections between these committees, Dr. Beauchamp has reminded me that, Sherm Garnett, who's a Dean Emeritus from the James Madison College, will be part of this effort to facilitate these types of conversations. So, we're trying to get all the right people in the right spots to help move us forward.
Thank you. We also have a question about faculty appointments. Can people have an appointment at Wayne State and at Michigan State?
So what we are telegraphing to the world is that We understand the importance and the necessity of, for lack of a better term, dual citizenship. And we are not asking people at Henry Ford, for instance, that currently have an appointment at Wayne State to quote, divest. But we are emphasizing and strongly encouraging the pathway with Michigan State, because everybody knows that for the future, that's our primary partner here at Henry Ford. That is the relationship that we are building our future around and on. So it's a yes and type of a both scenario. We understand that there are existing commitments with Wayne State, just quite frankly, like Michigan State has existing commitments with other institutions, and that's great. There's no reason to view this through the lens of a zero-sum game. But for new people coming in, for new recruits, for those who've not yet gone through an appointment process and who maybe are earlier in their career, the priority will absolutely be with Michigan State.
Wonderful. And then we have a number of departments that reach across several disciplines. And these departments are asking, how would they position themselves to make the maximal contribution to the mission, like anesthesiology that reaches across several disciplines?
Yeah, I'm smiling because we are now firmly in the realm of be careful what you wish for. It's not a matter of being heard. It's a matter of, oh my gosh, yes, thank you for raising your hand. We need you. We're going to put you to work, because there's absolutely an opportunity for that. We wanted to take a few months to get the rubric settled, to get the HSC formed, to make sure that the committees had their marching orders and that there weren't any unforeseen, issues that arose during this process. But now that we've had the experience of just beginning to onboard, Dr. Leach and combining, our OBGYN and women's health enterprises, we're looking closely to see what are some other opportunities. There are departments that we have at Henry Ford that don't exist at Michigan State, so and vice versa, where that's a wonderful opportunity right out of the gate to say, well, now we have a whole new partner, and what can we do? There are other examples where there are very strong programs at each institution that can now find ways of operating together, either with two separate chairs or a chair that takes more of a focus on academics versus a clinical bent. Again, many different models and opportunities, but we are not about changing anything that is currently working. It's about how we can enhance what we currently have.
Wonderful. Well, we're just about at time, so I wanted to thank everybody for joining us today. I hope that you found the information today not only informative, but inspirational and motivating. I'm excited about all the wonderful things that are coming through the Q&A forum about the excitement and momentum, and that's wonderful. I'd also like to extend a special thank you to Dr. Beauchamp and Dr. Kalkanis for joining us today and for their leadership. We'll do our best to follow up on any other questions that we didn't get a chance to get to today. And we'll be sending out the information that you see on your screen today with any links or emails addresses, so you don't have to quickly try to jot them down now. And we'll also be posting a recording of this on our joint microsite for everybody. So again, if you've got any other questions, they can go to evp.healthsciences@msu.edu, and we'll send out the links for the website and any other information that was presented today. Again, just thank you everybody for attending, and we look forward to seeing you soon. Have a great day.